I would say that at this point of time, the situation is very worrying. The daily number of cases and deaths that we're seeing today in India and in other countries in the Southeast Asia region is of great concern to us. I would say that at this point of time, the situation is very worrying. The daily number of cases and deaths that we're seeing today in India and in other countries in the Southeast Asia region is of great concern to us. And we also recognize that these are underestimates that every country in the world, in fact, the number of cases and number of deaths has been an underestimate of the true number. And we need to do some exercises, to try to find out what the missed numbers there could be. But that's a separate exercise. It should be done, and we should be aware, because the better the data, the better the policies can be directed towards what's happening. Because let's remember that when we talk about excess mortality and people dying, they're not dying only of COVID. People are also dying of all the other illnesses for which they may not be able to access healthcare. So all of that together constitutes excess mortality, and studies should be done, and we have a methodology now that we share with countries who want to do that. Having said that, I think today the focus needs really to be on getting the control of the transmission, bringing cases down and bringing deaths down. And we've seen in country after country that the moment you start bringing cases down, you will also bring deaths down. It always follows. The WHO strongly believes that the TRIPS waiver that was proposed at the WTO by India and South Africa should be done. And the DG, Dr. Tedros, has often spoken about this, and the fact that this is the time during a pandemic to not worry about patents and profits, but to really think about how do we increase the access to the tools that people need, whether it's diagnostics or vaccines or drugs. So yes, we would like to see that happen very quickly at the WTO. But that needs to be also accompanied by a technology transfer and know-how transfer, because vaccines are complex things to manufacture. And it will take a long time for a company to learn to do it from scratch, even if the patent is not implemented. So what we need are the people, the companies who have the technology and the know-how, let's say for the mRNA vaccines, to be willing to share that, to be willing to transfer the protocols so that companies in other parts of the world can also start manufacturing and scaling, because at this point what we need to see are supplies of vaccines increasing globally. It should start getting better in the second half of the year as vaccine supplies ramp up. But in the next couple of months, clearly supply is less than demand, and so we need to use the supplies we have wisely and prioritize vaccination of the high priority groups. WHO has defined the populations that should be prioritized, like the frontline and healthcare workers and the older people and those who have underlying conditions. So because we want to stop deaths from happening before we vaccinate the entire adult population of any country. Just because you're vaccinated doesn't mean you can't get the infection. You are protected to a large extent, but not 100%. So you could still get the infection, you could be asymptomatic and be perfectly well, but when you're traveling, you could infect others. So that's the scientific reason for saying that a vaccination card doesn't mean that you're totally immune to infection. The ethical argument is, of course, that not everyone has access to the vaccines just now. So you're already creating a double advantage group. An advantage group who's been fully vaccinated, can freely travel, and the disadvantaged group who wants the vaccine. It's not that they are resistant to it, they want it, but they haven't had an opportunity to have the vaccine, and they are being prevented from traveling. So I think we need to make the travel rules, which are both based on science, but also on equity and ethics.